everyone, and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or the ARC IPC. With summer quickly approaching here in Alabama and the number of people participating in outdoor activities steadily increasing, vector-borne diseases are a significant concern for our community and for the nation. Vector-borne diseases, or diseases transmitted to humans through an outside vector, typically an insect, have influenced human health and behavior throughout history. Some common examples include the Black Plague being transmitted by fleas, or most recently, Zika being transmitted by mosquitoes. In this podcast, we will be discussing tick-borne diseases and why people in Alabama should be concerned and take preventive measures against ticks, especially during the summer months. Joining us today to discuss tick-borne diseases is Dr. Jonathan Rayner, Associate Professor in the Department of Microbiology and Immunology at the University of South Alabama's College of Medicine and Director of the University of South Alabama's Laboratory of Infectious Diseases. Dr. Rayner received his PhD in microbiology at Colorado State University in 1998 as part of the Arthropod-Borne and Infectious Diseases Laboratory, where he studied the factors influencing vector competence for yellow fever viruses and dengue virus. He then completed 2 postdoctoral research programs with the American Society for Microbiology and the National Centers for Infectious Diseases at the Centers for Disease Control and Prevention. Dr. Rayner has continued his work in the private sector until 2017, when he joined the University of South Alabama to direct their Laboratory of Infectious Diseases. Currently, Dr. Rayner focuses on assessing pathogen-host interactions that contribute to the pathogenesis of emerging and re-emerging viruses, as well as mosquito-borne and tick-borne infectious disease surveillance efforts since 2018. Thank you for joining us, Dr. Rayner.
Thank you.
And after my long-winded discussion or introduction, we can go ahead and get started talking about ticks. Could you tell us a little bit more about ticks in general? Things like when are they usually active? Where are they usually found? Things like that.
Sure. So ticks are obligate blood-feeding ectoparasites, which essentially means that they have to take a blood meal between each stage of their life. There are actually 4 stages: eggs, larvae, nymph, and adults. Each of those stages requires the tick to take the blood meal. They will then fall off of the host, molt, and then can attach to a separate host. So obviously, as a blood-feeding insect, they are a prime candidate for transmitting infectious diseases that may be found in the blood. The ticks actually are most active during the spring, summer, and fall months. Although here in Alabama, you will find them year-round. In those more temperate regions, you will actually find them year-round.
So what kind of ticks or what species of ticks are most commonly found in Alabama?
Over the 4-year survey that we conducted starting in 2018, the Lone Star tick was the most predominantly found tick in the state of Alabama, throughout the state of Alabama. This is known as Amblyomma americanum. It's actually a very voracious feeder, and indiscriminate. So it can act as a vector for a number of important infectious diseases of importance to humans. We also found quite a few black-legged ticks, or Ixodes scapularis. These were found predominantly, however, on deer, and as a result, we really only found adults because that is the preference for those ticks. Other ticks that we found in less abundance include the American dog tick, Dermacentor variabilis, as well as the Gulf Coast tick, Amblyomma maculatum.
Are these ticks typically found in more rural areas, or can they be found in less rural areas such as like city parks or things like that as well?
So ticks like to feed wherever the vertebrate host may be. So city parks, anything like that, certainly is not going to be free from the presence of ticks. It will really depend on how those areas are groomed and what vector species may be present there. I believe you'll find them more frequently in those wooded areas associated with tall grasses, leaf litter, those types of things. That's where they can stay hydrated, moist, protected, and come into contact with those vertebrate hosts.
Gotcha. And I know you mentioned deer as being one of the vertebrate hosts, and clearly humans are another possible host. But what other kind of common animals are they typically on? I know dogs are a common one that people would think of.
Yeah, so domesticated animals are relatively free from infestations because they are domesticated. We're providing them hopefully with medicines. If the dog is kept outside or a cat is kept outside, then certainly they can be a host. But predominantly it's going to be wildlife, small rodents, rabbits, mice. You'll have larger mammals, even birds. But then, as you said, deer. Humans are not a typical host, simply because our contact with them is relatively limited. Right? Most of us spend a good bit of time indoors, and video games has done a great job of helping limit the spread of some tick-borne diseases. Just because the kids are not in the woods playing, well, then the chances of actually getting exposed to a tick decrease.
And I know you mentioned the pathogens that these ticks can spread. I know people are very often aware of things like Lyme disease, but I know from our background research and more common knowledge now, Lyme disease is typically not local to us and maybe one of the more extreme options for a tick-borne illness. But what illnesses are typically seen in Alabama from ticks? Or diseases, I should say.
The most predominantly diagnosed tick-borne disease is spotted fever rickettsiosis. This is typically associated with that Gulf Coast tick. There's a Rickettsia parkeri down here. They've also talked about spotted fever rickettsiosis, Rocky Mountain spotted fever, for example. We don't really see that here. That tends to be a more significant infectious disease, often resulting in mortality. Spotted fever rickettsiosis, typically associated with a mild fever and a rash, doesn't really progress much beyond that. It all really depends on the immune status of the host that it may come in contact with.
Yeah, and I know in the past, historically, it seems that we maybe see less tick-borne diseases in the Southeast than in the Northeast. But with current trends in the news, it seems over the past few decades that's been on the rise. I mean, I know one of your areas of research is keeping a handle on where those ticks are and kind of where they're spreading. What do you think is causing this, and how could we kind of prevent being affected by it?
Sure. And I think surveillance is the key, right? So yes, we hear a lot about tick-borne diseases in the Northeast, and that's because of the association with Lyme disease and the significant pathology and even chronic pathology that's associated with Lyme disease. As we have started to look more frequently and specifically for these things, the CDC requires reporting of specific tick-borne diseases to get a better sense of that, right? And so we're seeing greater numbers of cases because I think we're looking for it more. So when reporting began, back in, I think it was like 98 or something like that, we only had like 5 cases of spotted fever rickettsiosis. You look back at 2018 and there were over 600, 700 cases. Has anything changed between then as far as what we do? I would argue that it hasn't changed, right? There were probably more people out in the fields and getting exposed. They just weren't being diagnosed, right? This is all really dependent on the ability of the clinician to have the tests that are available and do the differential diagnosis to say, oh, you have spotted fever rickettsiosis.
So that surveillance and reporting are very important, is what I'm gathering.
Yes, and for example, one of the things that we've learned in this 4-year surveillance study that we did, spotted fever rickettsiosis is the most predominantly diagnosed human tick-borne disease. But the tick, the Gulf Coast tick, and the pathogen, this Rickettsia parkeri, are actually found in low abundance. So the question that me and my colleagues have is, okay, if they're not here, then what actually is causing this number of spotted fever rickettsiosis cases? So what we find is that the Lone Star tick is found in extreme abundance, and it is highly associated with spotted fever rickettsiosis species that was previously not believed to be associated with human infections. And if you speak to the CDC, they'll tell you that those are probably misdiagnosed cases because the assays that they use are not very specific. So you get some cross-reactivity. A person may have been exposed to that pathogen because of having been fed on by the Lone Star tick, but that may not actually be what's causing the pathology that's observed. And very few, less than 10% of those cases reported to the CDC are actually confirmed. So I think it really speaks toward the need for more significant surveillance programs to better understand the factors that are contributing to the diagnosis of these cases and the implications for human health.
Yeah, absolutely. Yeah, I'm glad y'all are out there monitoring it then, especially for Alabama. And I know you kind of touched on it a little bit when you mentioned immune systems, but are there certain people that are more vulnerable to tick-borne diseases?
Yeah, I mean, anytime you're in a situation where you're immunocompromised, and certainly, there's greater chances that that disease can take a more significant or have a more significant impact on human health.
So I guess we can, we're getting close to time, so we can kind of wrap up. What's some advice or some resources you could recommend to the public to help educate people and help them understand better how to prevent that spread of tick-borne diseases and prevent themselves from getting bit by ticks?
Yeah, so the thing is we want people to get outside, right? For a healthy immune system, body, all of that stuff, getting outside is really, really important. Unfortunately, by doing that, your risk of exposure to ticks increases. So making sure that you're wearing appropriate repellents, that you're checking yourself after having gone outside, or even your pets. Oftentimes pets can be a source for the tick because if they bring it into the house, the tick may drop off and then get on you after it's molted. Being aware and realizing, especially in Alabama, that you can be exposed to a tick throughout the year, that you will need to be diligent then about checking yourself, using bug repellents, those types of things. The CDC actually has some really great resources on the distribution of the ticks, the different types of ticks, what diseases they carry, and resources that may be available for diagnosis. If you get a tick, oftentimes it's a good idea to save that tick. And if you start developing signs, you can actually take it with you to your doctor's visit, and they may even be able to test from the tick as opposed to trying to test from the individual. And then, even resources on how best to there's all kinds of arguments of how you should best remove a tick. But they have resources there that will tell you, how you should remove the tick, what you can do with it, those types of things.
Oh, wow, that's interesting. I would never think to save the tick, but yeah, that when you think about it, that makes sense. Also, we'll have to share some of those resources as well when we share this podcast. But thank you so much for joining us, Dr. Rayner. I know I've learned a lot about ticks now. And thank you, everybody, for listening. Please tune in next time for another episode from Standard Precautions and Beyond, Conversations in Infection Prevention and Control with the ARC IPC.